closed, and it was just an insanely busy, overwhelming. It was an adult emergency department. And my attending leaned over to me and said, "You see this? The ED is the heart of the hospital. If this place beats strong, the whole hospital lives." I didn't really fully appreciate it then, but I understand it deeply now. And that's why tonight means so much to me. I'm profoundly grateful to the Nationwide Foundation, thank you, Steve, Nationwide Children's Hospitals, my leaders, Tim Robinson, Catherine Krzyzewski, and I'm grateful to my wonderful emergency medicine team who are my family of choice. There they are, and some of them are U of M supporters. As I am, sorry. But, and also, I'm grateful to my mentor, Leslie Mahaloff, who's here, who started me on the journey at Nationwide Children's and recruited me, and to my longtime mentor, Dr. Ron Mayo, who's here from University of Michigan. He's Professor Emeritus of Emergency Medicine at U of M, and he's here, so that's fantastic. He started me in PCOR, and I wasn't quite sure what I was doing, but I was like, "Oh, you'll be fine." So, my wonderful family's here, Rachel Marie, who's my daughter, Hans, and Sherman can't be here, my other son, and then my life partner, Rick, his family, and lastly, but not least, to my amazing mom, who started me on this journey and taught me unconditional love, resilience, and optimism. So I'm gonna but I want to also be clear, tonight's is about recognizing what it means to invest in emergency medicine. Why does emergency medicine matter? We're the front door of Nationwide Children's Hospital, as Catherine said. We see families on the worst days of their lives. We're incredibly good at resuscitation and saving lives. No one wants to be in the ED. Hands up anyone who wants to be in the ED. I'm serious, it's terrible. It's, you have to go to the ED, it's terrible. But we make a difference to the kids and families we serve, and we set the tone for the rest of the hospital. More than half of our patients at Nationwide begin their journey in the ED. We are here 24/7, 365 days a year. We're the place where uncertainty walks in at all hours, where life-changing moments unfold, and where people see, sometimes for the first time, what Nationwide Children's really stands for. When emergency medicine is strong, the entire system is strong. Quality rises, safety rises, efficiency rises, community trust rises. We're the barometer of the hospital's values, lived out in real time with real people in the most vulnerable moments of their lives. This endowed chair in emergency medicine is a transformational investment. I actually tried to do a search on this. It's Peds Emergency Medicine, and there are less than 10 in the country, and I think there's only 5. And so this is amazing, thank you. It tells faculty and trainees that and the entire institution that emergency medicine is mission critical. It signals stability and long-term commitment and anchors talent. Most importantly, an endowed chair gives emergency medicine something it rarely has: the ability to think long-term, to look beyond the demands of the next hour or the next shift, and to build something enduring. Emergency medicine is not disease specific. We've had a really tough time getting funding from the NIH because we're not asthma, we're everything. We're good at lots of things, but not very deep. First 2 hours of your resuscitation were brilliant. Leave your patient in the ED for longer than that. Anyway, that's where we're trying to go. So we're historically underfunded by the NIH and other federal agencies, because federal agencies fund disease research, and so they don't fund emergency medicine per se. Our ED has come a long way in the last 10 years, and I would rank us as one of the top in the nation. I would say top 3, definitely top 5. We have transformed from a great clinical ED to a national leader. We recruit trainees and faculty from top programs in the country, and I'm so proud to say that we're developing the next generation of leaders in our field, and I see about 5 of you here, maybe more, so thank you. We've worked to create a culture of joy in our emergency department, and we have improved resilience, and our ED now is a great place to work, and I love that. So this chair allows us to pursue long-range questions, the ones that improve patient flow, reduce disparities, enhance resuscitation, strengthen disaster responses, and transform how care is delivered. So I plan to create seed funding for bold, innovative ideas around healthcare delivery in RED. This will allow us at Nationwide Children's to create a gold standard academic program around ED health, care delivery, and operations that we will publish and disseminate nationally, with the ultimate goal of generalizing these findings to other pediatric EDs so we can improve care and outcomes for critically ill or injured children, not just at Nationwide Children's, but nationally and internationally. I'm deeply honored to carry this mission forward with gratitude, with humility, and with great optimism for what we can build together. Thank you.